as a respiratory physiologist, we've always been interested in how do you know you're breathing. And most often when I ask that question, everybody feels they're breathing, because you just did. And there are various types of breathing that we feel. And so I've always been interested in how do you, not only do you, how do you know you're breathing, but how do you discriminate between the different types of breathing that you can feel. And so my one slide that to keep in the 5 minutes is some ruminations. Because I teach in a veterinary school and there are lots of cattle around here, I've decided to ruminate. And my ruminations on this are to look at what is the bottom part of Dr. Cameron's square and how we connect those sides into the central nervous system. So as an afferent physiologist, I've been very interested in how do you transduce these signals that we're sensing and get discrimination of different types of sensations. And so what I have here is I have a list of just a few of the receptors that you are using right now when you sense your breathing. So you have everything starting at the nose, going all the way down into the lungs. Plus, if you actually attend to it, you'll feel your breathing move your skin. You feel your abdomen move. You have muscles that are moving. And so all of these various afferents have different pathways into the central nervous system. Some are through the cranial nerves, which we're most familiar with. Some are from spinal nerves coming in through the spinal cord. And so the question is, how do I differentiate between a feeling of respiratory effort, a feeling of not having enough volume, getting enough volume? How do I differentiate between not being able to sense certain parts of my breathing? So how do I know I'm having my nasal breathing versus mouth breathing? And so how does this process occur? And so blatantly stealing from the Drosophila literature on how eye information is processed, you have multiple afferents that are going to feed into second-order neuron systems. Those second-order neuron systems are a process by which those afferents are going to feed into these neurons through a variety of pathways. And so in essence, and this is all made up, so I don't have, we do have some data on some types of neurons, but I'm trying to come up with a conceptual framework with how can we generate specificity in sensation. And the first step is the second order integration of a variety of inputs. That second order integration is then going to be either in the brainstem or go to the brainstem. There are some of the local circuits that Dr. Cameron talked about that occur within the lung and also within other systems, and those will then send a signal into the central nervous system. And we call these behavioral control assemblies. And the reason we're interested in that is how do I convert your breathing pattern into a swallow pattern? You're sharing the same pathway, you're sharing the same neural networks. But if you don't have a proper swallow pattern, you get aspiration. And thank you very much. That's the other reflex that we're very interested in is cough. How do I convert the respiratory neural network into a cough neural network? We use behavioral control assemblies, which then can integrate the integrator, if you will, to produce specificity in behavior. And those can either be reflexogenic processes, or they can actually be sensations that can be generated, such as the feeling of high CO2, or the feeling of respiratory effort, or the feeling of air hunger. Those then systems in this conceptual process will then feed into either a discriminative pathway, so I can have, in essence, a somatosensation of that, or, as you all know much better than I do, it can have a very strong affective pathway in which you have a very emotional response to those changes in respiratory sensation. Then you're going to get a motor behavior, so the other side of Dr. Cameron's box is it either reflexogenic from the brainstem processes or from other processes that occur from higher brain systems. And so our conceptual model at this time is that mechanisms for network reconfiguration involve retasking existing elements, suppression of existing elements, recruitment of previously silent elements, all in the process of making a new reconfigured network functionally from a existing network. In other words, your respiratory control system just produced a cough. 5 minutes. 5 minutes. I mean, yeah, all right, yeah, let's give it up.